We're now down to the wire in the mid-year budget debate following 2 full days of contribution. Wrapping things up, the Prime Minister and Minister of Finance, the Honourable Philip Davis, before heading on to the Senate. That's expected to take place on Monday. Earlier today, though, we heard the Minister of Health making a bold prognosis about the nation's healthcare system. Corval Pye from Tonight reports on why the Davis administration feels its upcoming legislation will give a shot in the arm to a whole lot of struggling Bahamians.
Our administration is heading in the right direction, implementing a more robust universal primary health care coverage.
The health minister came to this mid-year budget debate fully aware of critics' attacks at this administration's spending and swirling questions about the overall state of the public health care system. So, Dr. Michael Darville's remedy to silence detractors was to talk up what he calls the government's powerful social-economic public health initiative, including fully transitioning to universal primary health care coverage. Legislation, he says, is on the way to create a national health insurance authority.
As it stands, the NIB chronic drug prescription plan, now managed by my ministry and currently providing free drugs for chronic non-communicable diseases for just over 44,000 Bahamians, mainly governed by healthcare workers and their families.
This figure, the minister says, will eventually more than double as coverage is extended to more NHI members.
The 160,000 plus registered NHI members who suffer from chronic non-communicable diseases like hypertension, diabetes, heart disease, certain types of cancers, renal insufficiency, mental illness, and other illnesses will finally have access to life-changing medications free of charge.
His ministry, Dr. Darville contends, is no longer managing systems, but rather leading a movement.
Free medications for chronic non-communicable diseases for patients with NHI across the country in both the public and private sector.
Completing this powerful initiative, as he refers to it, Dr. Darville says, is the 50% reduction on VAT on food items set to take effect next month. And finally, for patients suffering from chronic non-communicable diseases, the health minister announced that they will soon have access to healthier and affordable choices at food stores. For the Bahamas Tonight, I'm Corval Pye from